Did you know that because of air travel, any disease in the world is less than 24 hours away? At the Snohomish Health District, we believe it's our responsibility to be a key part of your defense against illnesses, because you deserve healthy places to live, work, and play. And that, at its very core, is what public health is all about. Vaccines and awareness of your risks have been proven to be the most effective ways to protect yourself and your friends and family from illness. How do we help arm you with that protection? With a team of highly skilled public health nurses, disease specialists, and outreach workers who are always working for a safer and healthier Snohomish County.
Our role in keeping the community safe is mainly catching outbreaks right at the beginning when we get reports, and we want to make sure there's no epidemic or outbreaks going on. If we have one case, we want to make sure we contact everybody who's being exposed to make sure that everyone gets on medication and that they do not keep getting sick and spreading it around the community. And we've been working with the school nurses. If we have new reports and we know a student goes to their school, we have to let them know. And if there's a need for a school letter to be sent out so that parents can watch for symptoms, that's what we do.
The health district helped me with the pertussis outbreak by providing signs and symptoms information to give parents and the students so that we could inform them as to what they needed to look for. I work to keep students healthy at school by verifying their vaccination records, by teaching them about health, hand hygiene, covering your cough, staying home when you're sick, and not spreading the disease.
In some cases, an effective vaccine hasn't been developed yet. Sometimes public health is the vaccine.
What I do, delivering medication to people who are diagnosed with tuberculosis. If you imagine your loved one riding the bus to school and somebody in the back seat coughing out blood and being sick with TB, our program, are the people who are standing between you and the ill individual. That's the importance of our job.
Preventing risky behaviors and addictions is the best way in keeping people healthy. But when the choices have already been made, public health's efforts shift to providing access to treatment, avoiding the spread of illness, and preventing deaths.
So the people I work with are folks that are been diagnosed with HIV and have been deemed to be out of care. Folks that are not in care for HIV have a higher risk of transmitting HIV. The other folks that we work with are folks who might be eligible for a new medication called PrEP, or pre-exposure prophylaxis, which is actually kind of like the birth control for HIV. And in our office here we have posters and things here that people can kind of visually see that this is a safe place. Being able to have someone from the health department go ahead and find those folks and find those partners and inform them of their possible exposure also helps prevent disease by bringing those people in and having them be aware of what's going on.
If the needle exchange weren't here, there would be a lot more disease in our community, not only amongst the folks who are using our program, but their families, children. Syringes would be found way more often. I don't really know where else they would go. The Snohomish Health District plays a huge role with our program. They've always supported us. Also, we have Kathy Perkins is our hepatitis outreach nurse that comes from there. She's here on Thursday evenings to do hepatitis screenings, as well as if we need her to go out into the field with us, we can call and arrange that, and she'll come with us and meet, so we can meet clients wherever they are. So they've been a major supporter of our services and what we do.
Public health's role is education, prevention, and hepatitis C is my focus. Viral hepatitis programs and outreach programs, so I go to where the people are at. They're marginalized, substance using, the highest at risk for hepatitis C, typically are not going to go to private providers and say, I'm injecting heroin, would you test me for hep C? There are no vaccines for hep C. Hep C, however, is curable, so linking my clients to care is very important. There is treatment for hep C.
They also have funded our naloxone overdose program. They've purchased all of the medication and given a test to make the kits and give it out there.
Naloxone is the opioid antidote, and we give kits out and do training for those who are going to be around those who are using opioids or opioid users themselves. Naloxone kits are the best defense for opioid overdose.
Public health is always there. We are your local nurses, disease investigation specialists, outreach workers, and valued community partners. Whether it's behind the scenes or leading from the front, the Snohomish Health District is there to promote healthy habits, prevent illnesses, and protect our food, water, and environment from health threats. Because that's what public health is about, being your best defense.